Hi there, my name is Lynn. I'm going to be taking care of you today, okay? Do you prefer to be called Ashlyn or Miss Turnage?
Ashlyn.
Okay, hi Ashlyn. Let me take a quick look here at your name band. I need you to tell me your name and date of birth.
Ashlyn 020504.
And your medical record number that matches up, okay. Beautiful. Do you have any allergies, Ashlyn?
No.
No? Okay, I see you got an IV here. Let me just check it out, make sure it's intact. I'm gonna flush it. Very good, beautiful. Okay, Ashlyn, first thing we're going to do today is do a basic head to toe assessment. I'm going to be assessing the different systems of your body from the head to the toe, okay? I want to start with the hair, skin, and nails. So first I'm going to inspect your hair. I'm looking for any bugs. I don't see any. Your hair looks very healthy. I'm going to take a look at your scalp. Any redness or tenderness on your scalp?
No.
Okay, I don't see any lesions. Let's take a look at your skin. It's nice and warm and dry, perfect. Do you have any rashes or anything on your body?
No.
No. Okay, Ashlyn, I'm going to take your hand here. I'm going to squeeze your skin and let go. I'm measuring the elasticity. This is called skin turgor, and it snaps right back in place. That means you're well hydrated. It's very healthy, okay? Another thing I'm going to do is measure your capillary refill. I'm going to press down on your finger and release and measure how long it takes the color to come back. And for you, it's less than 3 seconds on the left hand. That's the perfect. Less than 3 seconds on the right hand. Less than 3 seconds on the left toe. Less than 3 seconds on the right toe. Perfect, Ashlyn. Let me just take a quick look at your nails. They look beautiful. Okay, Ashlyn, moving along, we're gonna take a look at your ears, eyes, nose, and throat, okay? I'm gonna start with the ears. They're nice and symmetrical. Have you had any pain in your ears?
No.
I'm gonna shine this pin light in there. I don't see any draining, redness, any tenderness. Moving on to the right ear. Any drainage from this one? Any pain when I touch it?
No.
Very good. And take a look at your eyes. Look at me. Your sclera are nice and white, no jaundice. Okay, Ashlyn, I'm going to shine the light in your eye. I want you to look straight ahead, okay? Very good. Okay, your pupils are equal and reactive to light and accommodation. That's great, okay? Let me take a look at your nose. Any drainage?
No.
Your nose is nice and midline. Open up and say ah. Gums are nice and pink. I don't see any abscesses or drainage from your tonsils. Your uvula is midline. Perfect. Now just smile for me. We got a nice symmetrical smile. Perfect. Okay, Ashlyn, we're going to be moving along to the respiratory system now. Have you had any difficulty breathing?
No.
Good. Okay, I'm going to take a listen to your lungs from the back. If you could just turn that way for me. With the camera. Okay, I'm going to start up here at the left upper lobe. I want you to take a deep breath. I'm going to move directly across to the right upper lobe. Deep breath. I'm going to move down a little bit on the right side. Deep breath. Directly over on the left side. Deep breath. Down a little on the left side, deep breath. Directly over on the right side, deep breath. Little down on the right side, deep breath. Directly over on the left side, deep breath. And move over to the side a little bit, left side. And on the right side, deep breath. Okay, very good, Ashlyn. All I heard was clear breath sounds. You can turn back around this way. I didn't hear any wheezing, no stridor, no other adventitious breath sounds. Everything was very clear, both sides. Okay, Ashlyn, have you ever used one of these Incentive spirometers before?
No.
We like to give these to our post-op patients, and really any patient in general. It just exercises your lungs, increases the volume, and helps prevent pneumonia. So the way you use it is you put it in your mouth and you suck on it as hard as you can like a straw. And the goal is to get that blue thing as high as you possibly can. Very good. So we do this 10 times an hour while awake, okay? Alright, that wraps up our respiratory system. I'm going to move on to cardiac. I want to touch your carotid artery, okay? I'm just feeling the pulse is very strong. That's a good finding. We never press both at the same time, okay? Because that could make you have a syncopal episode. Right side, bounding, very good. Okay, I want to feel your radial pulse here. It's nice and strong. I give it a 2+. 2+ on the right side. 2+ on the left pedal. 2+ on the right pedal. 2+ on the right dorsal pedis. And 2+ on the left dorsal pedis. Very good, you have nice pulses. Now I'm going to listen to your heart. I'm going to listen with both this part of the stethoscope and this part of the stethoscope, which is called the bell, okay? I'm going to the right sternal border, second intercostal space. This is your aortic valve. Now I'm going to move to the left sternal border, second intercostal space. This is your pulmonic valve. Third intercostal space, left sternal border. This is Erb's point. Now I'm listening with both sides of my stethoscope, okay? And then your tricuspid valve at the fourth intercostal space, left sternal border. And then your mitral valve at the fifth intercostal space, midclavicular line. Very good. I'm going to palpate the PMI, which is the point of maximum intensity, at the fifth intercostal space, midclavicular line. There's no lifts or heaves there. Now, I did not hear any murmurs. I heard very good rhythm there. No weird sounds, so I think your heart is pretty healthy, okay? Okay, next I'm going to listen to your aorta. Your carotid artery. I'm listening for what is called a bruit. If I was to hear a bruit, that would mean maybe you had some stenosis going on in your carotid arteries. But I did not hear any bruits, so that's a very good finding, okay? All right, that wraps up our cardiovascular system. We're going to move on to our gastrointestinal system. For this assessment, I need you to lay supine, which means on your back. I'm going to take just a generalized look at your abdomen here. Have you had any constipation, any diarrhea, vomiting?
No.
And your last bowel movement was today? Okay. I'm going to take a quick listen to each quadrant of your abdomen. You've got 4 quadrants, and I'm going to be listening for bowel sounds, okay? I'm going to start at the right upper quadrant. Lots of gurgling. Moving to the left upper quadrant. Gurgling, very good. Left lower quadrant. Right lower quadrant. So Ashlyn, I heard a lot of gurgling there, okay? That means you have hyperactive bowel sounds. Nothing wrong with that, okay? Everything's moving nicely. So next I'm going to take a quick listen to your aorta with the bell and my stethoscope. I'm listening for a bruit, just like I did with your carotid arteries. I hear no bruit, okay? That's very good. That means there's no stenosis going on. Okay, Ashlyn, I'm going to be touching your stomach. It may tickle a little bit, okay, but try to be still. First, I'm just going to feel with one hand here. Any tenderness? Let me know if anything hurts, okay? Now I'm going to try it with 2 hands. I'm just feeling, Ashlyn, for any masses, any enlarged organs, any areas of tenderness. Let me know if you feel anything. Everything feel okay? Still a little tickling? Okay, very good, Ashlyn. You can sit up now. Okay, moving on. Your genitourinary system. Have you had any difficulty peeing? Any pain? Okay, very good. While you're here at the hospital, we'll be measuring your intake and output just to make sure that what comes in goes out, okay? All right. Lastly, we're going to move on to our musculoskeletal system. Ashlyn, have you noticed any swelling, tingling, or numbness in any of your extremities here?
No.
No? Okay. I want you to squeeze my hands as hard as you can. You got a tough grip there. I'm gonna put my hands here. I want you to push as hard as you can with your feet. Very good. Okay, Ashlyn, there were very strong reps, very strong pushes, equal on both sides. That's very good. Okay, Ashlyn, I think that's gonna wrap up our head to toe assessment. I've got your call bell here. Do you have any questions for me? Okay, here's your call bell. If you need the nurse, you hit the red button, okay? I'm gonna make sure 3 of your side rails are up so that you don't fall out of the bed. Is there anything I can get for you before I leave?
No.
All right, Ashlyn, it was nice meeting you. Let me just go over here and wash my hands. And I will be back in a few minutes to check on you, okay?
Okay.
All right, thank you.